Here we're going to do the Socko stretch uncoupled. So basically what that means is we're going to move Kiki's hip into flexion with internal rotation. Internal rotation is one of the most important planes of movement we have in the body. People exhibiting hip pain, lower back pain, tend to lose the ability to internally rotate their hip, especially in an uncoupled plane of motion when we add in flexion. So like before, we lift the knee, come under. We move Kiki into 90 degrees, ideally more, of flexion, like so. I'm going to take a knee. So from here, I'm going to move her now into internal rotation of the hip, this way. So I just move here. So notice how my left arm is bracing down her hip here. Now I'm using my shoulder actually. So I'm here, this way. So this is very much uncoupled hip biomechanics. I'm cradling her knee. I'll take up the slack. We hold 1, 2, 3. Athletic populations with limited hip internal rotation are candidates for low back pain, groin pain, hip pain. We can play with the amount of flexion. So when I move into a flexion, I'll give her back the rotation. Yeah. This way. I'll show you a couple of different postures for this. Flexion. Can use my knee. Open up. So you just have to pick your posture depending on the range of motion of your client, height, etc. On a real big stiff guy or woman, I might come into this position. Rotate. This way. Key things of concern. If you're working with a client who has very limited internal rotation, there are other ways to get internal rotation. This is one of the postures we use. What you want to be cautious of is that when I rotate Kiki's leg, that we're getting the rotation from the hip. So imagine if there's a rod going from Kiki's hip to her knee, the rotation should occur around that plane. Someone like Kiki can trick us, because watch, we can get a bunch of movement, but this is all knee. Feels different, right? Mm-hmm. So we don't want this motion, although it looks very similar, right? But see how I'm bracing her femur, so this is all coming from the knee joint. We want the motion to come from the hip joint, and that feels very different. She should feel a stretch deep in the hip capsule. So if you have a client who is experiencing knee pain, medial knee pain when you do this, just be cognizant that you're not torquing the knee. A few ways to combat that other than what I just mentioned. You can alter the amount of flex and bend in the knee. You can close the knee angle over here and open this way. That's one way. This more closed pack position stabilizes the knee a little bit. It may allow us to get more rotation from the hip. Show you on the other side. Slide up. Here I'm stabilizing the knee, or the thigh, sorry. I stand here. So I'm trying to encourage the femur to rotate. So many different ways to do this. You can take a knee, stand facing the client. You can face away, so now I use my other knee to brace. I encourage motion here. Encourage range of motion this way. So now I'm really working the deep six in this flexed, abducted, internally rotated posture. And like I said, Kiki is very mobile through the hips, so this position is somewhat comfortable, attainable. Not all our clients getting into this position, that's okay. There's other ways to work internal rotation, which we'll show in later videos in here, etc. So this is called the Socko hip uncoupled. Here, internal rotation, internal rotation, all the same, just slightly different ways of achieving the same plane of movement.